Yeah, just showing you the Softwave here. This device is got an applicator on it. There's a water cartridge in the machine. It sends a tube of water and it goes in through here. There's a little spark plug inside the membrane here. So there's a little spark plug in there basically that creates a water wave that goes at 3,000 plus miles an hour. And then when you shock it, it basically sends that little pulse through the tissue. On uninjured tissue, it feels fine. On areas that have inflammation and scarring or those kind of things, it'll be a little more intense. It's creating a shearing effect in the tissues and actually creates this feeling of discomfort. It doesn't feel great, but we try to make sure we dial down. You can take a look here, the settings. The settings here are like, you can come on over here and just show. So we have different levels based on what, I don't know if you can see that on there, but basically based on the energy, we can bring it up or down 7 or 8. It goes all the way up to 16. Most people, we're not going up that high. We're probably staying anywhere around 8 or 9 or 10, just depends on the body part. So, and then it just shows you how many shocks we're doing. Usually for a body part, we might do about 500, maybe 1,000, just depends on what we need or how acute it is. And 3 hertz just means that's how many shocks it gives per second. So 3 shocks per second. So we usually keep it on there just so you know. But basically this is a pretty high level machine. It's definitely very expensive, but it's very well worth it because it's getting the results for clients, and that's what I've been really finding really helpful. So I'm going to just show you here and get you moving, get Bob going here and get him shocked up here. So we'll show you this. Basically, it's not a 10, people ask if it's a 10 unit or it's ultrasound. But it's kind of using the waves. It's kind of like ultrasound, I guess, but it's very high energy wave. We do use ultrasound gel, so people then maybe think that. And then what we do is put some ultrasound gel on there, and all we need is the contact with this membrane to the skin, and then basically from there we go over the spot, and then I let you know anytime you need to feel like it's too intense, we take it easy, we make sure we're not too intense. It's gonna feel intense. We let people know that they are in control of what they feel, that we can always slow it down or stop or move to a different area. Okay, so here we go. So we go. Is it okay? Yeah, okay. So just let me know as we go. And I just kind of move it around. Usually the first little bit, I'm trying to explore where he might have some spots. A lot of times they'll make a different noise. Right there? Yeah. So we're going to hang out in the spots that are a little more intense to try to get that shearing effect in there. What's cool is that this tissue, the sound waves are actually creating a shearing effect in the tissues that create a stimulation of your body's own healing response. So like stem cells are actually getting stimulated within 24 hours of the treatment, but then continue to proliferate up to 8 to 12 weeks after the treatment. So even after the first treatment, you're still getting the effects of your body creating the healing. And then combined with the rehab process, which is just kind of supercharged my results with people, they can actually they do their exercises and then they get more results from those exercises because as you move, it's stimulating the body to heal. So that's kind of what we're doing. How are we doing?
That's good.
A little spicy there?
Yeah.
So we find some spots. That one a good one? Okay.
That was really good.
Yep.
Yeah.
So right, we see this on knees with a lot of medial joint line issues. We'll just kind of work on those spots and kind of hang out. Try to find the most tender areas and work on those. And can you describe what it feels like?
Just kind of a little tickly, really, to be in.
Tickly, yeah.
Yeah, and then as you get over different areas, it's not, to me, it's not that intense. It actually just feels good, almost like a little relief.
Yeah.
And then it kind of gets a little bit when you feel more, and then it starts to go away. So
Yeah,
kind of
yeah.
those peaks and valleys.
Right, so that's very typical. We'll find that it's pretty intense on certain spots, and after we leave it there or we go to it for a little bit and then come back to it, then it feels like, oh, it's not as bad as it was. And we keep track of the energy level, how much intensity we're doing for different spices. Let me know how that is. Okay then? Yep. And so we always just keep in mind where things are. We kind of make sure that we take our breaks as we need to. He's actually doing pretty well. No problem. This is the third time going over the knee. So a lot of times after the second or third treatment, people really feel a big turn of how they're feeling. First visit, it actually happens as well. People feel like, wow, it feels a lot better even after that first visit. I love that, but it's not always what happens. So, some people even after the first visit may feel more intense pain. And the reason because of that is because we're kind of creating this kind of worse before you get better phenomenon. It's kind of like I tell people, it's like a snow globe. Sometimes you shake up the process and the body's like, what are you doing? But actually I tell people that's actually a good sign. Your body's actually kind of rebooting what it needs to do to heal. And so nothing to be too concerned about. Most people need between 5 and 6 of these treatments to an area to create the max proliferation of these stem cells to heal the area. And so that's what we want to make sure that we follow through with that. And that's one thing I just make sure that people, even after they're feeling better after their second or third visit, that they continue to go through this process. How you doing?
Doing good.
Okay, yeah. I usually don't talk this much during the
you're
treatment,
fine.
but you're doing pretty well.
Yeah.
But the idea is like trying to make sure that we get all the spots that are the highlights of the areas based on examination. Hey, as I push around, and actually I can use this as a diagnostic as I go through these spots. You're like, woo, that's a little more tender. That's kind of what we want to do, and then we can kind of know how much we need to push on it, or we need to put the stimulation on that spot. So, but that's the idea. This is kind of how it works. Creates this little stim here, and just kind of goes through things, and not too mysterious. It's just something that isn't really well known yet. So I really wanted to have a video here to explain what's going on and how things, what to expect. So, hopefully this gives you a better idea that when you come in, this is what we'll do. It's nothing too mysterious. It's just something that's a little different than what you may have seen. It's FDA cleared device. It's evidence-based. It's definitely creating a lot of great results for people around the country and around the world. So I'm really happy to have it in the clinic, and I'm happy to share it with whoever would love to share it, because I know we're going to help people get back to their active lives that we want them to be. So, yeah, thanks.